Okay, so today we are doing a full head-to-toe assessment. So first I would walk in and introduce myself to the patient. Hi Brian, my name is Alyssa and I'm going to be your nurse practitioner today.
Cool.
And then I would wash my hands. And then I would start by doing an overall inspection of his appearance and his head and his scalp, making sure that it was symmetrical and in normal shape. I would feel in his hair, feeling for any lesions or any abnormalities, noting the texture of his hair. I would palpate all of the bones in his skull and the normal ossificus back here. Next, I would palpate his TMJ joint. Put my fingers right about here. Open and close your mouth. Noting for any popping, any crepitus, which he doesn't have any of. Next, I would move on to testing the function of cranial nerve 5, which would be his trigeminal nerve. I would have him test the motor function of that by having him clench his teeth, clench your teeth. Okay, good. Now move your jaw side to side. I would test the sensory portion of that, which would be the sensation for sharp versus soft sensation. Close your eyes. Tell me if this feels sharp or soft.
Sharp.
How about that?
Soft.
Very good. And then I would test cranial nerve 7, which would be the facial nerve, by having him smile, frown, puff your cheeks out. Very good. Okay, so next I would move on to his eyes. I would note the color of his sclera, which are white. I would note the irises and the pupils to make sure they are symmetrical. I would note any lesions, any drainage, any crusting around the eyelashes, any lesions in the eyebrows, which there aren't any. Can you take your glasses off? Open your eyes. I'm just going to pull down on your eyelids. The conjunctivi are a normal pinkish reddish color, no lesions, no drainage. Next, I would check his pupillary reflection. Can you take your glasses off, please? Just going to shine the light in your right eye. And the pupillary reflections should be slightly nasal and symmetric. Next, I'm going to check cranial nerve 3, which would be his pupillary response to direct and consensual, his direct and consensual response to light. So look straight ahead. I'm going to shine the light in his right eye, and the pupil constricts, and I'm going to shine it in his right eye one more time and look at his left eye, and the pupil there constricts as well for the consensual response. And again on the left side, the left pupil constricts, and the right pupil constricts as well. Okay, so the next thing I will be testing for is for accommodation, which is also cranial nerve 3. So I'm going to have you focus on my finger. Now focus on the wall across the room and focus on that finger again. And the pupils constrict when focusing on a near object, and then they dilate when focusing on a far object. So next I'm going to test for convergence. Follow my finger. And he's able to follow my finger to within about 5 to 12 centimeters from his nose. The next thing I'm going to check is his peripheral vision by confrontation, which test cranial nerve 2. So tell me when you can see my fingers.
No.
And again.
No.
And again.
No.
Okay, and his peripheral vision is intact. And the next thing I'm going to test is his 6 cardinal viewpoints. So just follow my finger with just your eyes, but with your head. So I'm going to start midline. I'm going to move laterally and up, down, back, and back to center. And then the other direction, up, down. And there is no nystagmus noted. So the next thing I'm going to do is the fundoscopic exam. I will get my ophthalmoscope. Maybe take the glasses off of that. I'm going to start with his right eye. I'm going to look for the red reflex. And then I'm going to slowly move him. And I'm looking for the optic disc or the physiological cup, and following that to also see the macula and the fova. And then I'm going to do that on the other side as well. Again, looking for the red reflex. And then your eye open. Next, we're going to move on to inspecting his ears. First, we're going to inspect the outside, make sure there's no drainage noted, make sure there's no lesions, no crusting. We're going to do a little tug test. We're going to pull on his ears. Any pain?
No.
Any pain back here? No. With the tug test, if there's pain, it could indicate an external canal infection. Pain behind the ears may indicate otitis media. So next we are going to take a look inside his ears. I'm going to get my otoscope for this. And we're going to pull up and back on the pinna. We're going to note any cerumen, any redness, any drainage. We've got the cone of light at about 5 o'clock here, and the tympanic membrane is a nice pearly white color. And we're going to note if we can see the handle of malleus as well as the umbo. And then we're going to look on the other side. Same thing, pull up and back on the pinna. Not for any cerumen. And the cone of light appears at around 7 o'clock, and the tympanic membrane is again a nice pearly white. Next, we are going to test cranial nerve 8, which is also called the acoustic nerve. So we are going to start with the whisper test. I'm going to cover his right ear, and I'm going to whisper a common word.
Apple.
Correct. And now I'm going to do the same thing on the other side, see if you can hear it.
Baseball.
Very good. Next, we're going to do the Weber test, which involves striking the tuning fork and then placing it on the top of his head and having him tell me which ear he can hear it in.
Both ears.
Okay, good. So there's no lateralization. And next, we're going to do the Rhine test, which involves again striking the tuning fork and then placing it on the mastoid bone. Tell me when you can no longer hear this. Okay, can you still hear it now?
Yes.
Okay. Then we'll do that on the other side. Can you hear that?
Yes.
And then you can no longer hear it.
Yeah.
Okay. Can you hear it again?
Yes.
Okay, very good. And that's how the test is supposed to work. AC hearing is supposed to be longer than BC. So air conduction should be greater than bone conduction. So next we're going to do the nose and the sinuses. I'm going to, again, have you take your glasses off just for a moment. I'm going to palpate the frontal sinuses. Any pain?
No.
Okay.
No.
So these are the frontal sinuses and the maxillary sinuses. And next we're going to inspect the nose, inspect for any lesions, any drainage, which there are no lesions or drainage. And then we're going to look into each nares. You're going to note the mucosa, which is a pinkish red. We're going to note for any mucus. We're going to note the carbonate. I'm going to look on the other side here and note the same thing. No lesions, mucosa